Well, happy Easter, everyone. It is April the 12th and it's Sunday. Now, I've got a slightly different video I want to show you today. I'm going to talk to Raghad, who's a medical scientist in Iraq. And first of all, we'll talk about the situation in Iraq and a little bit about the situation in Iran. And then she's got some very interesting insights on some of the science behind this COVID-19 pandemic. So do stick around for this discussion. So, Raghad, where are you just now?
I'm in home. I'm isolated myself at home in Baghdad.
Okay. And what's the situation like in Baghdad at the moment?
The Iraq is completely locked down since 4 weeks ago, but some areas don't follow that. Some areas people are still going out and they are making their daily routine, but most of us are isolating ourselves at home. I hope others would listen. The problem is maybe economical because many people have to work daily to earn their bread. This is the problem, and they need help really. There's some NGOs or some personal effort are going from people to help others, but still the problem is very big in Iraq. As you know, we passed many wars and we have a lot of poor peoples. They need help, they need support, and they have to understand what's going on.
So there's a lot of people have to go out to work that day to make the food for that evening.
Let's say some places, not all places, Iraq and Kurdistan is a little bit better. It depends whether it is most inside the cities, it is locked down, but outside people, they don't take the rules or they don't follow the rules, what they have to do. This is the problem.
So the understanding is better in the cities than in the countryside?
Maybe, and maybe in cities they are using forces, military forces. The government are using military force to force the people to stay at home. This is it.
So there's more law and order in the cities, and it's more less law in the countryside.
Yes, it is in fact. Yeah.
Right. And have you seen people that are sick in Baghdad?
Personally, I didn't see people sick, but there are numbers of people. Mostly in all Iraq, we have about 1,300, a little bit over 300 in all Iraq. But this is within 1 month isolation. I think we have to do more to identify the sick people or those who are carrying the virus.
So, Raghad, you're a medical scientist, aren't you?
Yes, somehow. I teach immunology in Baghdad University as well as virology. I'm professor in the university since more than 20 years ago.
I never made professor. You've done very well.
Thank you. Thank you.
So do you think there's a lot of undiagnosed cases in Iraq?
In Iraq, mostly they're using PCR technique to diagnose, and sometimes they do X-ray for the chest and other medical tests. But I think we have more. We have more than this number, and we have to isolate every sick person. We have to isolate every carries the virus. This is the problem. We need more work for that.
Is there any antibody tests, do you know?
I think there is a lot of talking. Some of antibodies tests are giving false negative, which is not true. We need precise antibody tests. I heard in Korea they're using a good antibody test, but I don't know if WHO announced that. I used to follow the instructions from WHO mostly.
Yeah, so the antigen test is reliable, but the antibody test is not reliable at the moment. Yeah. That seems to be the thinking.
It is the best. Antigen test is the best because it gives if we have a disease or not. I don't care at the moment for the antibody, maybe sometime later. Now we want to limit this pandemic. We need the antigen test, we need the PCR, and PCR is the best test ever.
But there's a shortage of testing in Iraq as in other places.
I don't think, because we got a lot of help from China, and we have help from WHO, maybe other countries. Others are helping us. We have facilities and we have good laboratories, in fact, in Iraq.
Yeah.
And if the devices of PCR is now more available. And also we have people who are professional in diagnosis that. I think the problem, we just need more hard workers to get the infected people. One time I wrote on my page, they have to go down in supermarkets even to test people. They have to ask every sick person where he went and where who he was contacting with and so on. We have to identify. The problem is that people, they don't say they are sick. They hide their sickness for many reasons. Some may think, oh, it's like a flu, they don't care. Or maybe they feel afraid of going to hospitals for many reasons. However, they should go and announce that they are sick, so they be tested and to confirm they maybe have not corona, maybe other disease or other infection. This is the problem.
People don't really understand, many people don't understand how serious this disease is.
Yes, John, this is a really problem. You can't imagine. One of the members in the parliament of the Iraqi parliament was saying this is like a flu. Can you imagine? And parliament is saying that, and he's responsible about health sector. It makes me crazy. How come? And he's a doctor, and he's saying just this is a political virus. It's not time to talk about politics. It's time to save people's lives. This is a problem.
Absolutely.
How many people would listen to that video and they may think it is true?
Absolutely. Now, what about the situation in Iran? Do you know much about that?
I have a friend in Iran, and he used to tell me the situation is still terrible in Iran. They have a problem that the government would allow normal life to go back. Number of cases is more than 49,000 up to 2 days ago, and they are still increasing. Iran also need help. Really, they need help. They really need support. This is something related to humanity. We have all to unite. This is our existence, John, as you said.
Absolutely, we agree. So you think there's been a lot of deaths in Iran? Is it hard to tell from where you are, or you got friends there?
Yes, a friend of mine told me a number of deaths is more than what is announced, really, and people are crazy by sterilizing. You cannot imagine. Some of them are drinking chlor. They thought just
drinking what?
Chlor, Cl. Chlor. That's they used in in beaching clothes.
Oh no, bleach.
Yeah, and they did. Some of the youth.
Oh no.
Yeah, because it was announced that Dettol would not kill viruses and use chlor, and they have just drink it. I don't know. They mixed it maybe with alcohol, and they did. People are going crazy. We don't need to be panic. We have to think wisely about this. I hope things be better.
So people are dying as a result of misinformation about drinking bleach and drinking alcohol.
Yeah, there are some reports and even videos about that.
Oh, that's just awful. That's awful, isn't it?
Very awful, very. It's the responsibility of the governments everywhere. They have to reach people and tell them what they have to do and what's the advice, and to support people, especially the poor people, those who need the help, really, so they can stay safely at home.
Absolutely, because the virus won't stop at any border. It will just keep going.
This is it.
Yeah. So how do you see things going in Iraq in the next month?
I think they have to increase number of tested samples. if they keep on testing the same number, I don't trust these numbers. It is very low. What is they just tested the 33,000 sample within 1 month, which is not logic. I think we agree. Some countries are testing these numbers daily. For our situation, we have a neighbor to Iran, which is the pandemic there is very high, and even our situation. Completely, we have many poor people, still not people are believing in the seriousness of this virus, a lot to be done. I can't guess, as you know, science depends on numbers, number of the tested sample, number of the positive, so I cannot guess. I hope things will be better in all the world.
So we need massive testing, don't we? Massive.
Yes, yes. I used to say that because, John, even you were saying that in your videos, which I heard and listened a lot. We have to quarantine, and then to isolate. Just quarantine will do nothing, nothing. It is nothing. It should go side by side by isolating. Why we are keeping people at home if we are not isolating the sick people? This is should go all together.
Do you know what sort of death rates there are in Iraq and Iran? Do you think more percentages are dying, higher percentages are dying?
In Iraq, I don't know much about Iran, but in Iraq, I think the percentage is high. Don't you think it is? We have about 70, maybe more than 70 deaths, and all positive cases is the 1,318, which is this is high. Maybe the increase in death rate indicate we have more sick people, more positive samples. Yeah.
4 or 5%.
Yes, yes, unfortunately.
But that probably indicates there's a lot of people undiagnosed as well.
This is it. That's why we need more tests. And if those were undiagnosed, keep on walking and keep on doing the routine life, they will spread the virus more and we'll have more infected people. Everyone should understand that. This is a fact. This is a science. We all hope this will go. We all hope this lockdown would finish. We all hope our life be normal. But we have to work scientifically and we have to use our mind and logic to do it.
Absolutely. And we also need the governments around the world to make sure we get 1 billion tests.
Yes, this is very important, in fact. They have to understand this. They have to. I don't know why our Ministry of Health don't follow that. They have to believe our tested samples is very low and it means nothing for our situation. It is nothing.
The situation in my country is the testing's very low as well.
How many number of tests do you have?
It's about 3.5 tests per 1,000 of the population.
But it's okay somehow. How many number of population?
About 60 million.
Yes, yes. We have to increase number of tests.
We have to increase number of testing, yeah. Absolutely.
It needs effort. It needs too much effort.
Yeah.
Media should support that. Media should, this is an important point. Media should understand the importance of testing and they have to support that. So people would understand why we are quarantined and even others would understand the importance of it.
And not to take cures that aren't proved by science, like alcohol and drinking bleach.
Yes, yes, that's crazy. I think maybe they were panicked too much or so on.
Yeah.
And it happens maybe in some areas, but not all the people do it, sure.
Yeah. Right, Raghad, do you think this is a fairly stable virus, or do you think it's going to carry on mutating?
It is an RNA virus. RNA, it is type of the nucleic acid, of course, and RNA viruses usually mutate faster than other viruses. But for coronavirus, I read a report that it mutated in China and it have two forms. One of them causes a severe disease and with very difficult symptoms. The other is a bit lighter and it's not severe symptoms, fine, let's say, light symptoms, okay. But who knows? Once the infection continues, it means the replication of the virus is continuous. And once we have more replication, so we have more chances for mutation. Other point, RNA viruses, I really feel afraid of them because in science there is a fact about superviruses, which is RNA virus if infect an animal or a human, and this animal or a human infected with another RNA virus, they will have a chance to make a supervirus. This is a theory in science called supervirus. Supervirus usually causing more severe diseases, and this would create maybe a harder problem that is difficult. While we are working with RNA virus, we have to be more careful, more accurate in our data, accurate even in our work. It is not like any other, not like DNA viruses. DNA viruses, I think they are more stable than RNA viruses. I hope it will not mutate. I hope. Yeah. Please, Corona.
I hope so as well. But it is possible for two RNA viruses to combine to make a supervirus.
Yes, yes. And this is, who can guess what is the new virus will be? The problem, and especially if we have influenza also RNA, a corona RNA. So we have a chance for superviruses.
So that's why it's all the more important to get the viral numbers in the world down as quickly as we can.
Yes, yes, this is very important, very important.
To reduce the chance of this mutation.
Everybody should help. We are all must cooperate together to stop it, This is something related to humanity.
Absolutely. Just one more question, really. Are you optimistic that one vaccine will do for all the different viral subtypes in the world?
I don't know. Something related to science, something related to work. Maybe yes, maybe no. Who knows? This is, John, scientific working, you can never guess. We have to try and see what is our result of our experiment. Then we announce. We cannot give a previous talking, wow, we have a vaccine. Wow, we cannot get a vaccine. We have to try. We have to try in the lab and look at the result. Then we think of the result. That's it. This is science.
That spoken like a proper scientist.
Thank you.
It has to work, doesn't it? Yeah. If it doesn't agree with observation, it's useless. That's absolutely. Yeah.
Yes.
Yeah. Okay.
I hope maybe on 2021, I hope we'll have a vaccine.
Yeah.
We have something when we work in molecular biology, maybe it makes things much easier. And this help in vaccination development. That's it.
Yeah. And are you hopeful about any particular therapeutics?
I don't believe, scientifically, I don't believe, only in plasma.
Okay.
Because plasma, and this is a very old type of therapy, and it has been used wide, and we know the one who's infected would have an antibody. This is normal, and I trust in it, and I advise all the world. Now we need a plasma, because this is can give maybe, let's say 99%. We don't have 100% in science, but I give 99 or 95% of curing this disease if we turn to work on a plasma from infected persons or cured person. I trust this. Everything for me is just announcement for, let's say, for marketing, for any other reasons, but does not cure. Does not.
Yeah.
For curing, yeah.
So the plasma is just passive immunity, isn't it?
Yes. However, it will give immunity for some time. It is a short time. At least we need this time to make a vaccine. We need this time to make a good therapy. Plasma maybe would solve our problem. I hope the scientists will look at the plasma, because this is available now and this is easy and it has been used several times.
So you'd have to take plasma from people that had recovered from the disease already.
Yeah, I advise this, really I advise, because it is trusted. It is trusted and it will give good result. I heard Kuwait, Arabian countries in the Gulf will try plasma, and this would be very good. I think it will give a good result, plasma. And I don't believe all these drugs, what they say. They may just give some reducing symptoms or helping the patient to live, but they don't cure the disease.
So put their supportive treatments.
Yes, yes. No more. But the plasma, I believe, would cure. Yeah, from immunologists. As an immunologist, believe in plasma, don't believe on anything else.
Okay, that's good. Do you think vitamin D is important for immunity?
Yes, very important. It is needed to immune response. It facilitates the replication of immune cells. It is very required, and even I advise my friend and colleagues to take vitamin D. Personally, I used to take vitamin D, and I take a high dose, 50,000 international units per month. I take that since 2 years ago. I keep taking it. Because, to have a vitamin D from sun, we have to be on a certain time on sun. Even we are living in hot countries, but we don't get our enough vitamin D. So when I tested, my vitamin D was very low, and then I keep on taking vitamin D. It is for all the health, and especially for the immune response, yes. And I think what you have suggested, John, about Black Americans and that their bodies, their skin doesn't make vitamin D is very scientific and completely right. I hope I can make a research on this. It would be very interesting.
Yeah, and as well as immunity, it's heart disease and colon cancer and multiple sclerosis, perhaps diabetes, perhaps.
Of course.
Yeah.
Yeah.
That's absolutely brilliant, Raghad. I've no idea. I think that might have recorded.
I hope so. Is it recording?
I think it might have done. It was very good. I'm glad you think the same about the vitamin D. I think it's just a big blind spot that the world has. Yes.
This is very brilliant idea from you, John. Really.
Well, it's not from me. It's from people the scientists that have studied this have made it popular. So can I ask you one more thing? What do you think about treating? Have you gone?
Yes, I'm with you. Yeah.
If someone's got a fever.
Yeah.
Do you think the immune system works best when they're febrile, when they have a fever? Do you think the immune system's working better?
Yes, of course. When we have a high temperature, it means the immune system is working, prostaglandin is secreted, and we are under high stimulation, and we have to keep on this fever as much as we can. This is important. Unless we are concerning children, maybe they have a different situation, maybe children.
Yeah.
Yeah.
But for adults, for you and me, if we get a fever, we should not take drugs to bring the fever down.
Yes, we should not take medicine, in fact, yeah.
Yeah, I agree completely, yeah, I agree. Right. Thanks, I'm just going to see if that's worked. Alt.